Well, the world was stunned to learn 90s heartthrob of Beverly Hills 90210, Luke Perry, died after suffering a massive stroke. And joining us to talk about the signs and symptoms of a stroke is Dr. Daniel Kantor from FAU's Neurology Medicine program. Welcome, doctor.
Thank you so much.
First of all, to kind of, I guess, explain the basics, what is a stroke? What happens in the body?
So a stroke, there's really two types of stroke. There's the most common type where 87% of people have it, and it's called an ischemic stroke. It's sort of like a heart attack. We call it a brain attack. Not enough blood flow gets to the brain, and that can cause damage and cause lots of symptoms. 13% of people have what we call a hemorrhagic stroke. That's basically a bleed into the brain, and that can be from trauma, it can be from high blood pressure. There are other causes as well.
Now, what causes stroke, and what do you think could have caused it in someone like Perry, who was just 52 years old?
It turns out that the American Academy of Neurology did a study, and 15% of people are actually adolescents, young adults, and even into their middle ages. So strokes don't only affect people who are older, and 52 certainly is young. There's lots of reasons why he could have had a stroke. I think the first question is going to be whether he had an ischemic stroke or a hemorrhagic stroke. But things that can lead to strokes are things like having high blood pressure, things like working in industries where there's a lot of pressure, industries like you're in, and things like too much body weight, things like high blood pressure, high cholesterol, not exercising enough, the things that we eat. And then there's other things that you can't control. Whether you were born a man or a woman, that's going to affect it. Men have more strokes than women. And things like your age, you can't control your age. As beautiful as you can look, you can't actually change how old you are.
So it obviously does not seem to discriminate on really any age, any person.
It doesn't discriminate, except if you look across the United States, there's 140,000 people who die of stroke every year. And the Southeast, where we live right now, is really the stroke belt. There's a lot of stroke where we live.
So what can people know as far as the signs and symptoms of a stroke that people can write down right now, just in case?
To try to make it easy for everyone to remember, we came up with an acronym, and it's called FAST. And the idea is, if there's a problem with the face, you ask a person, well, smile. And if it looks droopy on one side, then you might say to them, lift up your arms. And if one arm droops more, and then speech for S. Are they having slurred speech? Are they mumbling? What's going on with that? And then time. As fast as possible, call 911. Don't try to solve this yourself. This is not like fixing a car or doing something else. If someone's having a stroke, there are things we can do to really bust that clot and bust that stroke and really save your life.
So following that list fast, that's a really helpful way of keeping up with that. Now, there is a new UCLA study that suggests having extra body fat may be linked to having an increased chance of surviving a stroke. Is that the case?
There actually is a new study, and what it shows is actually what we call an obesity paradox. Because on the one hand, we're saying that things like gaining too much weight are actually risk factors, but it turned out when you looked at people, whether they were underweight, normal weight, overweight, or obese, people who are obese, they survive more. But there's some interesting things that people should know about the study. Firstly, it's one study, and in medicine we like to see that a lot, replicate in larger numbers. Also, if you look at it, the researchers controlled for things like high blood pressure, high cholesterol. So they basically took away those issues. So if you're a person who's obese, but you don't have high blood pressure and high cholesterol, maybe there's something else protective in your body, or maybe the obesity itself. Fat storage does have nutritional reserve, but that does not mean go gain weight in order to prevent stroke, because the weight itself is actually a risk factor. I think the message, and especially the message for young people, especially young girls, is be at a healthy weight. Don't be too much, but don't be too little. Because underweight, they didn't have enough body reserve to be able to prevent the stroke.
Thank you so much, Dr. Kantor. I appreciate you taking your time.